Let's talk about a hip flexor strain. I'm Dr. David, orthopedic surgeon and sports medicine expert. A hip flexor strain is not one of the more common hip injuries, but it can be really challenging if you have one. This is an injury to the muscles and tendons on the front of your hip. They're the quad muscles in the front of your thigh, but as you get up toward the front of your hip, those quad muscles form tendons like the rectus femoris that attach to your pelvic bone and are involved in leg extension, lifting your leg off the table, for instance. And it can be really, really tricky if you injure one. I used to see one when I was the doctor of a professional soccer team because I'd see basically one of our soccer players go to kick a ball and a player on the other team would go to kick it at the same time, what we call a 50-50 ball. So they'd go to contract that muscle, but the foot wouldn't go anywhere, and that would injure the hip flexor. There's other ways to injure that, but it's usually a traumatic event. Now, I have had patients in running and cycling that have just had sort of a nagging ache and pain to that area that gradually came on over time. So it is possible to get an overuse injury to that area as well. But again, it's typically more an acute event, a traumatic event. Now, what you're going to look for is pain right in the front of your hip, especially with physical activities. Weightlifting exercise, sport-specific exercises that stress that area. You go to an orthopedic surgeon or a sports medicine physician, there's a variety of physical exam tests that we can get to sort of recreate your pain as you go to lift the leg off the table against my resistance or the doctor's resistance, for example, that can be really helpful. A lot of times we'll get x-rays more than anything just to rule out other causes, because with a true hip flexor injury, typically the x-rays are going to be negative. The exception to that would be 14 or 15-year-old boy where maybe that tendon pulls a little piece of bone off as it injures, but that's not typically the case with adults. Fortunately, the treatment almost never involves surgery. Occasionally, the whole tendon can pull off and it can retract down the thigh, and that would need surgery to reattach the tendon, but that's fairly rare. The treatment is going to be rest from whatever your sport or exercise is until it heals. It's going to be things like physical therapy to work on ultrasound and E-stim to decrease pain and swelling at first, but then to work on strengthening and range of motion, and then jogging and sport-specific exercises. Depending on the extent, if it's just a mild strain, it might just be a week or two, but if it's a more serious injury, you could be looking at many weeks or even a few months. So it can take a while, but fortunately, it rarely needs surgery. I hope this video was helpful. Click the video below for much more helpful information, and I look forward to seeing you next time.